Pregnancy is a big adventure. It can be exciting, but it can also be hard on your body. There are so many changes happening, and no two pregnancies are exactly the same. Hopefully, you'll find something in this video that's helpful or encouraging if you're pregnant too. So let's jump right in. Let's start with protein and why it matters. Yes, there are lots of nutrients you need during pregnancy, but we'll save most of those for another time. Protein is special because you actually need a lot more of it now. Eating enough protein with your meals and snacks helps you feel full for longer. If you've been feeling extra hungry lately, which is totally normal during pregnancy, getting protein throughout the day can help you feel satisfied, keep your energy steady, and balance your blood sugar. Good sources include beans, hemp seeds, you've been loving those lately, eggs, yogurt, cheese, and different kinds of meat. When you're pregnant, your body needs a lot more water. Why? Because your blood volume goes up. You're making amniotic fluid for the baby, and your body is just working harder in general. You've been drinking a lot every day, partly because you're first year, and partly because it just feels good to stay hydrated. Pregnancy can really change your digestion. Heartburn, acid reflux, nausea, bloating, and even constipation can show up. Some people get it more often than others, but here's what's helped you. Don't lie down right after eating. Sit up, chew slowly, and eat at a relaxed pace. Drink a glass of almond milk. Why almond milk? Many store-bought cartons have added calcium carbonate, which can act like a mild antacid. Sometimes you've felt super bloated during pregnancy. Hot tea like ginger or peppermint has been soothing. On extra bloated days, you go easy on gassy foods like cauliflower, broccoli, and beans. A few tips that have helped. Eat plenty of fiber-rich foods like nuts, seeds, veggies, and fruits with the skin on. Prunes classic, but they work. Get enough magnesium with your doctor's advice, which can help soften stool. You regularly moisturize your belly, legs, and any areas that are stretching as you grow. It really helps with the itchiness. Sometimes your belly skin just feels so itchy. You've been using sweet almond oil. No stretch marks yet, but if they come, that's completely normal. Pregnancy changes your body in so many ways, how it looks, how it feels. It's important to be gentle with yourself and learn to accept those changes. Does good sleep even happen during pregnancy? If you're pregnant and sleeping like a baby, lucky you. For you, sleep has been harder. Fitting comfortable takes effort, and you wake up more to use the bathroom. Your secret weapon? Pillows. You don't have a special pregnancy pillow, but you've built a great setup with regular ones, always one between your knees, to keep your hips and pelvis open. You also try not to drink too much water before bed, so you're not up all night. One more tip, getting out of bed. Your midwife taught you to roll to your side and push yourself up with your arm. This protects your abs and helps prevent extra strain. Pregnancy can make gums more sensitive and likely to bleed because of extra blood flow. You've switched to using a water flosser. It's gentler, adjustable, and helps keep your teeth and gums healthy. You've dealt with pelvic girdle pain, low back pain, round ligament pain, and hip pain. Seeing a pelvic floor therapist has been a huge help, and you recommend it to anyone with similar discomfort. Your pelvic floor supports extra weight now if it's weak. Other muscles in your back and hips take over and can get sore. You do Kegels and other exercises from your therapist, and you try not to waddle to keep your pelvis balanced. Walking has been your main exercise during pregnancy. Because of hip and back discomfort, you walk slower and take shorter steps, but you still enjoy it. You go out about 3 to 4 times a week, usually in the evenings with your partner. It keeps your body moving, your blood flowing, and it's great for you and your baby. Pregnancy can be an emotional ride. Your feelings may change quickly, and if it's your first baby, there's a lot of uncertainty. Pay attention to how you feel and lean on your support system. For you, that's your partner. Talking things through has really helped you handle the ups and downs. That's it for today's video. I hope you found something useful or relatable. Share in the comments what's worked best for you during pregnancy. Let's help each other out.